Hi, I'm Rick Bell, and thanks for joining Workforce's ongoing coverage of the 5th anniversary of the passage of the Affordable Care Act. With me today is one of the primary architects of the ACA, Kathleen Sebelius, the 21st Secretary of the Department of Health and Human Services. Kathleen, thank you so much for joining me today.
Great to be with you, Rick.
Thanks. Initially, let's talk a little bit about your role in the early days of the ACA.
Well, I was appointed confirmed finally in April of 2008. So in 2009, I'm sorry, the last cabinet member to join the team, and discussions were already underway about a comprehensive health reform bill. And from April of 2009 until March 23rd, when the president signed the bill, we spent a lot of time working with Congress, working with the administration, outreach to stakeholders, framing what is the most comprehensive health reform in at least 50 years.
Mm-hmm. When you're living with ACA 24/7 as you did, was it hard to step outside and see what others and how they were dealing with the ACA?
Well, as you know, Rick, the law was signed in 2010, and it's really been a 4-year implementation process. We did a lot of outreach during the course of the passage, including dozens of congressional hearings, lots of amendments, 5 different committees in Congress considered the legislation, so there was lots of input. Plus, the president was gathering people at the White House, employer groups and insurers and consumer groups, and trying to understand what the impact would be. And then during the course of implementation, which was a multi-year effort, we continued with every draft regulation, with every step of the process, to have extensive outreach, trying to make sure that we got the balance right, how to protect consumers and implement the law. On the other hand, how to make sure there was a platform for affordable coverage and that we didn't scare companies from the marketplace, that people could live with the administrative burden, that we could move forward in an effective fashion.
Mm-hmm. If there's one message that you want employers to know about the ACA, what would that message be?
Well, I think there's no question that change is difficult. Most of the employers who will be impacted by the employer mandate, which the Congress is about to debate one more time, already are in the marketplace offering coverage. I think the good news for them is that their competitors are now going to also come into the marketplace, and they're going to have more choices, including some employers living in states where expanded Medicaid gives their lowest income workers an additional option. We have seen dramatic cost slowdown in healthcare in the last 4 years. That's indisputable and quite dramatic, and is going to be impacting everyone. And we're beginning to see some very positive signs on the delivery system side, hospital performance improving, people's health beginning to improve, lots more emphasis on provider care, issues that employers care a lot about with a healthy and productive workforce. So I would say it's early in the process. There's still kinks in the law that need to be ironed out, but so far the news is pretty good.
Mm-hmm. It seems that ACA has spawned an era of entrepreneurialism in healthcare. An unintended consequence, or did you have a hunch that that could happen?
Well, there was a definite hunch that it could and should happen, starting with the implementation of a broad-based electronic medical records framework that really started prior to the Affordable Care Act in the Recovery Act. That creates a platform for transparency and measurement, and really unlocks the world of healthcare for entrepreneurs and engineers and very smart, tech-savvy folks to make consumers and employers really in charge of healthcare in a way that they haven't been in a very long time. And what we're seeing, the market report from the end of 2014, again, was enormously positive. The healthcare sector continues to grow at a robust fashion. We're seeing technology and medical devices and drugs continuing to lead the market surge. So the notion that somehow this law was going to be dampening on the economy seems far from what's playing out in the market. The market has been very robust, and insurers are coming into the new marketplaces. 25% of the insurers are new in 2015. Again, that's a big bet on the fact that this framework really works.
Mm-hmm. Yeah. Does it surprise you that we're 5 years into the ACA and that there's still significant resistance, or that there's been such a strong push to drastically alter what you helped create?
Well, I won't say that I'm not disappointed that we haven't moved to the next phase, which is how can we work together to fix the law and make sure it's a continuous improvement. On the other hand, the effects are beginning to really reach millions and millions of Americans. We had the biggest drop in uninsured in this country in 2014. That downward trend is continuing. That's good news for everybody. I think we're seeing that the analysis is that employers did not leave the marketplace, even though many of them could leave because the mandate doesn't hit until this year for the larger employers and until next year for the smallest employers that are over 50 employees. So the news is that people continue to get coverage. Employers have more choices. Costs are going down and care is improving. And I'm hoping that as we get through this first phase of bravado again about dismantling the law, we'll start to realize that the impacts are profound and far-reaching.
Mm-hmm. And finally, where do you see ACA in 5 years from now? Did you build the law to be adaptable to a changing workforce and public?
Well, I think that it is adaptable. Again, the employer issues really deal more with health and wellness and a productive workforce. And that's certainly a framework focusing on preventive care, making sure that more of the people employers look to hire are going to come to that workforce in healthy condition, making sure that the bottom line is that employers can focus on their business interests and not spend huge amounts of time and energy trying to figure out healthcare, which was complicated and expensive, particularly for the smallest employers. That's all good news for them. And on the care side, I think we've got an enormous opportunity to get Americans really in better health in the long run. That's good for the economy, and frankly, it's really good for the country. We have pretty lousy health results throughout this country. Great care for some people some of the time, but not great care for everyone all of the time. And that should be a central focus, that employers and employees join together and really push hard at the health industry to change the way they deliver care.
Great. Kathleen, thank you so much for your time and continued success with the ACA.
Thank you so much.
All right.
Thanks for visiting with me.
Okay, thanks, Kathleen.